Let's face it, alcohol is a huge part of our society and culture on so many different levels that it's not easy to just cut it out completely after cancer. If you were used to drinking alcohol regularly or even just occasionally before your cancer diagnosis, it can really be hard to no longer enjoy a nice glass of wine with dinner or a cocktail when you're out with friends or at a holiday party. And you've likely heard different things say on social media about how red wine is healthy for you or that it's safe to have 1 to 2 drinks a day, but you probably wondered if that's also true for cancer survivors. So in this video, I'm going to be giving you some clarity on what is a safe amount of alcohol for you to be consuming as a cancer survivor, and I'll be giving you some powerful tips on how to stay within the recommended limits if you're having trouble doing so. I know I'm always telling you that I don't eat sugar and I have a really clean diet, which is true, but something I haven't shared with you is that I've struggled with alcohol consumption in the past. So trust me when I say I know how hard it can be, and the tips I'll be sharing with you are from personal experience. One thing I found really alarming is that in a recent study, they found that over 50% of US adults were unaware that consuming alcohol increased their risk of getting cancer. But I guess it makes sense. You don't see warning labels on a bottle of wine that alcohol can cause cancer like you would on a package of cigarettes. Also, thinking of the cancer center I work in, we have a protocol in place that we always ask our cancer patients if they smoke. And if so, we advise them not to while they're on cancer treatment, and we even have programs in place to help them stop. But we certainly don't have the same support or protocols in place for our patients who drink alcohol. So it's really up to the individual oncologist if they want to talk to their patients about the risks of drinking. But I know from experience that it rarely happens. Also, significantly less people are smoking cigarettes now compared to, say, 20 to 30 years ago. But studies have shown that globally, people are drinking alcohol now more than ever, and not just the occasional glass of wine. Excessive drinking is on the rise, especially amongst people in their 20s and 30s, and the prevalence of binge drinking has nearly doubled. It doesn't help that celebrities are now promoting it and even have their own brands, and it's constantly promoted as being fun and cool and a staple for any type of social event. So before I get into how much alcohol is safe for you to be drinking after cancer, I want to tell you a few important things that you need to know so that you can make an informed decision about whether or not it's worth it for you to drink. Similar to tobacco, alcohol is classified as a Group 1 carcinogen because it's been scientifically proven to significantly increase your risk of getting certain types of cancer like breast, mouth, throat, esophagus, liver, and colorectal cancer. Alcohol contains ethanol, which is a known carcinogen because it promotes the development and growth of cancer in several different ways. For one, ethanol raises your estrogen levels, which in turn increases your risk of getting breast cancer. Also, the breakdown of ethanol in your body creates something called acetaldehyde, which can damage the DNA in your cells and therefore lead to the development of cancer cells. We also know that heavy drinking can also weaken your immune system, which is crucial for fighting off precancerous cells or cancer cells that may still be lurking in your body even after you finish cancer treatment. So by limiting your alcohol to a moderate level, you can help your body maintain its defenses and reduce the risk that your cancer will come back. But here's what confuses cancer survivors the most. The American Cancer Society recommends that cancer survivors limit their alcohol intake to no more than 1 drink a day for women and 2 drinks a day for men. But it's also said that no amount of alcohol is safe. So which is it? 1 drink a day or none at all? Well, the only thing we can say for sure is that the more alcohol you drink, the more harmful it is, or the less you drink, the safer it is. So at the very most, you can enjoy 1 drink a day, but ideally you want to be drinking less than that. Say if you can limit your consumption to 2 to 3 drinks a week, that would be much safer. The American Cancer Society also states that women who do consume 1 drink a day have a 7 to 10% increased risk of getting breast cancer. And at 2 to 3 drinks a day, women are facing an increased risk of breast cancer of about 20%. That's actually a pretty big difference. And I know what you may be thinking, what about the times when I want to let loose and have a few drinks with friends? Is it ever okay to indulge more than usual? The key here is balance. It's okay to enjoy a night out every once in a while, but just be mindful of your overall consumption. Another important factor to consider is how alcohol can interfere with any medications you're taking. Some medications have side effects that are exacerbated by alcohol, one of the most common being liver damage. So if you're taking any medication, it's really important to ask your doctor about any potential interactions before consuming alcohol. And you may have also heard a myth that some types of alcohol are healthier than others, but the truth is that all types of alcohol, whether it be beer, wine, or spirits, all increase your risk of cancer equally because they all contain ethanol. So if you've been drinking more than the recommended daily allowance, I'll be giving you some effective strategies on how to cut back back on it in just 1 minute. But also, please know that you're not alone. 56% of US adult cancer survivors are current drinkers, 35% say they exceed the recommended daily allowance, and 21% say they engage in regular or occasional binge drinking. So if you'd like to cut back on how much you're currently drinking, here are some very powerful tips that I've personally found effective. One strategy is to announce it. Telling your friends and family about your decision to cut back on alcohol after cancer can really provide you with encouragement and accountability. It may even help them cut back on it as well, especially while you're around. Also, I want you to set realistic goals for yourself. This is another key step in the process. Rather than trying to quit cold turkey, try to gradually reduce the amount of alcohol you consume over time. For example, if you're used to having 2 drinks a day, aim to go down to 1 a day at first and then maybe 1 every other day. Do it as slowly as you need to. Even just 1 less drink per week is a win that you should be proud of. It doesn't have to happen overnight. It's better to do it slowly to ensure that you're successful in the long run. What I personally find the hardest is not reaching for a glass of wine when I want to relax or de-stress at the end of a long day. So for times like this, I want you to try to find another outlet. Think about what you can do to try to relieve stress that will also take your mind off of drinking. Good question, right? A great place to start is to try to find something that excites you but doesn't use up too much energy. Try a new hobby like painting, gardening, doing puzzles, learning a new instrument, I don't know, something to distract you but also something that you legitimately enjoy. You can also try doing relaxing mindfulness practices like yoga or meditation, or even just taking a nice long bath, painting your nails, or doing something that promotes self-care. This is so underrated, but it really does help. Most importantly, try to figure out what your personal triggers are. What leads you to drink? Whether it be work, family, social gatherings. Identifying the main reasons will help you develop strategies to cope with them that doesn't include alcohol. What I also find really helps is trying to find ways to socialize without drinking. I mean, I know it's easier said than done because most social events revolve around food or alcohol, but consider making plans with friends that don't center around drinking, like doing something active, going to see a play, or volunteering together. You can also try to surround yourself with people who support your decision to stop drinking rather than encouraging you to drink or that drink in front of you. There are some amazing online support groups for cancer survivors that can not only help you cut back on alcohol, but you can also benefit from sharing stories with people who know exactly what you're going through. They can help you develop a plan for managing your alcohol cravings and finding a personalized coping strategy. When you've already been through the trauma of a cancer diagnosis and cancer treatment, the last thing you want to do is increase your risk of recurrence. Reducing your alcohol intake is something that you can proactively do to decrease your risk that it'll come back someday. Also, aside from increasing your risk of cancer recurrence, drinking regularly has been proven to increase your anxiety levels and disrupt your hormone levels and the quality of your sleep. So making the decision to stop drinking or even to drink less can really have a positive impact on your overall quality of life. While it's okay to enjoy a drink every now and then, it's especially important to be mindful of your alcohol intake after battling cancer. Remember, your health is the most important thing in your life, so take care of your body and listen to what it needs. I really hope you found this video helpful, and if you have any questions or personal experiences to share, please feel free to leave them in the comments below. And as always, don't forget to subscribe to the channel so that the YouTube algorithm will show it to more people who can benefit from these videos as well. Thanks for watching, and I'll see you in the next video.